Hello, my name is Professor Roger Gadsby. I'm a GP by background, been a GP for over 30 years, and I've had an interest in pregnancy sickness for that long. I'm a part-time academic with positions at the University of Warwick and the University of Bedfordshire. In our research, about 80% of women who were pregnant had some degree of symptoms of pregnancy, nausea and vomiting. That can go from a very mild, where perhaps just a few hours of nausea in the pregnancy, to what another lady who described many hundreds of hours of nausea and over 300 vomits in her pregnancy. Using the P6 acupressure point with a device like C-bands has been tested in a couple of trials and has been found to be effective, and therefore it is a treatment that can be used by women who don't want to take tablets because of their fears of the effects of tablets in their pregnancy. Patients with pregnancy sickness symptoms often want to be discreet about therapy that they're taking. It may be that some women who are pregnant will not want to let on to their employers or even some sort of friends until they're perhaps at 12 weeks. We know from our research that the peak week of symptoms for pregnancy sickness is week 9. One of the most important things if you are going to be using an acupressure device like C-bands is to make sure that it's placed in the right place, because only over the right pressure point will it give the benefit to symptoms that have been described in the research. To find the acupressure point, place your middle 3 fingers on the inside of your wrist with the edge of the 3rd finger just below the 1st wrist crease. The acupressure point is located underneath your 1st finger, in between the 2 wrist tendons. Position the plastic stud facing inward over the acupressure point.